During this video, we will describe what can be expected when your pet has surgery at Belmont Veterinary Hospital. During check-in, the receptionist will review the treatment plan with the owner and answer any questions the owner may have about the procedure and the cost of services. After all questions have been answered, the treatment plan is approved and signed. Once the owner has said goodbye, a technician retrieves the patient and brings them to the treatment area to prepare them for surgery. It is very important that the owner leave updated contact information so that we can call during the day with any updates. The technician will get a current weight and temperature before the doctor performs a physical exam on the patient. If the patient has not had blood work within the past 30 days, in-house diagnostics are performed to ensure the patient can safely undergo anesthesia. Our in-house diagnostic machines analyze the patient's blood sample and provide instant results. This allows our doctors to make important decisions regarding the patient's ability to undergo anesthesia. Depending on the patient's age and type of procedure, the doctor may recommend X-rays for review prior to the surgery. Once the doctors approve the blood work, an intravenous or IV catheter will be placed. This provides a direct line to the vein for pre-anesthetic medications and fluids during the procedure. Our surgical suite is prepared with surgical supplies, heating pads, anesthesia, and monitoring equipment. A section of hair is removed at the surgery site to decrease the possibility of contamination. A preliminary cleaning will be performed to remove any dirt or debris from the surgical site. The doctor will indicate which medications are appropriate for the patient based on their weight and previous medical history. The technician will then prepare and label them for that patient. When the doctor is ready to start the procedure, a registered veterinary technician will administer the anesthetic induction medication through the IV catheter to sedate the patient. Sedation is necessary to properly place the endotracheal breathing tube in that patient. Once the patient is under anesthesia, we lubricate the eyes to prevent dryness. As a precaution, we take the patient's temperature during the procedure to make sure it remains in a safe range. Lastly, we provide a complimentary nail trim and ear cleaning after the procedure. IV fluids administered via a fluid pump help keep the patient hydrated and maintain their blood pressure. Special equipment is used to monitor the patient's heart rate, oxygen level, breathing rate, and blood pressure. The technician lays out the protective equipment for the doctor. This includes the hair cap, mask, surgical sponge, sterile gown, and gloves. The doctor scrubs her hands and forearms using an antiseptic hand scrub to prepare for surgery. The doctor then dresses in the sterile gown and gloves to prevent contamination of the surgical site. The technician performs a final surgical scrub to maintain a sterile area. A sterile field is prepared by draping the patient prior to the first incision. If assistance is required, a technician will gown up in the same sterile manner as the doctor. At the end of the surgery, the doctor will close the incision with sutures or staples. The doctor assigns a team of technicians for each surgery, making sure the patient is monitored at all times. Using a team approach increases patient safety during surgery. A technician stays with the patient until they are fully awake. Every patient recovers with a friend and goes home with their new toy. When the patient has fully awakened from anesthesia, the doctor will call the owner to let them know the outcome of the procedure and to update them regarding their pet's well-being. An aftercare sheet is completed by the doctor and any medications to go home are filled. Also, any additional paperwork or pictures are prepared for the client. During the patient's discharge, a technician will explain aftercare instructions and discuss any medications with the owner. The patient is then reunited with their owner. Any last-minute questions are answered at this time before the owner and their pet go home.